Okay, recording. Take one. Ready? Hello, good day, everyone. Welcome to Town Kids Facebook Live. And once again, my name is MJ Anisete, marketing specialist here at Town Kids. And today, we're going to talk about the comparison from a home care setting, which is what we offer for you nurses. And also, we're going to compare it to a hospital and also to some nursing facility. And we're also going to talk about from what happened just recently in New York, and the nurses there have protested from what happened in there for understaffing. So we have invited a very special guest, our one of our kind care nurse. Please welcome Ms. Roylene Solon. Hello, Ms. Roylene. How are you?
Hello, everyone. Good morning there sa Philippines. Good evening here. We're all
Yes,
good
good
here.
evening
How
there.
there?
It's good in here as well, Ms. Roylene. Thank you for asking. All right, so I'm just going to ask you some questions regarding for our topic. But before that, how's life there in the USA?
It's very fast paced here, and we're trying to adjust with the weather, with how the people here live. We're trying to adjust about a 360 degrees adjustment actually,
Oh wow,
but it's pretty fine. Everything's good. Everything's getting settled.
that's great to hear. So, are you enjoying your work as a home care nurse?
Yes, I do very much.
So what is it like working in a home care setting, Ms. Roylene?
So working in a home care, especially with Town Kids, where we are offering like a one-to-one patient ratio. So what you feel most of the time is you getting involved with the family, how you collaborate care with the patient, with the child that you're taking care of, how you monitor, how you actually see the milestone that the child develops every day. So that's something that we really don't see in the hospital because we only
Mhm.
it's a day-to-day basis there, but with home care you actually deal with them every day. You develop relationship, you develop trust, understanding with each other, you help each other. That's something that's really special with home care.
Well, that's great to hear, Ms. Roylene. Also, I've heard to the deployment team that you have experience working in a hospital before. Is that right?
Yeah, so I actually worked as an emergency room nurse for a bit.
Mhm.
Yeah, and then after that I had a few field opportunities. So those are two different fields. Yeah.
Uh, I understand, and I can see that right now. Uh, but before we enter to the from what happened to the recent news,
Mhm.
how would you compare your hospital experience before to your work right now as a home care nurse?
Right. So with in the hospital, you usually take care of a lot of patients. Like if you're assigned the ward, it would really depend on the capacity or how many admissions that you have. So usually meron tayong like 10 or let's say 20, and then how many nurses I worked with, like let's just say mga tatlo kami sa ward or five at the most, yung mga ganun. So um one nurse is to like how many patient usually you take care of, 5 to 6, swerte na yan. But what
Mhm.
happens if you're really understaffed? So you take care of one is to what, 50 patients, 30 patients, swerte na
Oh
yung
wow.
30. But if you get 50 to 60, then what do you think would what do you think would you feel, di ba? Yung parang you'd be burnt out, you'd be how do you say it? Mafe-feel mo like you're suffocated, like yung feeling mo ubus na kulang ka, which is kulang ka talaga, 1:50, di ba? So,
Totoo naman
you
po.
know, yeah, that's really something na parang mako-compare mo when you're
Mhm.
working with home care. Excuse me, you have like a one-to-one patient ratio. So, the difference is very like 100% more, 500% more if you compare
Mhm.
it.
Actually, I've heard Miss Ms. Roylene, merong common joke ang mga Filipino nurses. One nurse is to one ward.
Oo, meron gano'n. Kasi meron talagang nangyayari na gano'n. Like,
Mhm.
sortehan na lang. One ward. What if two wards, di ba? Float ka doon sa ibang ward, tapos work ka sa ward mo. Yung parang ano na, GGB. Gulo-gulong buhay mo na, no? Di ba?
Oh my. Grabe, I can't imagine yung mga nurses natin na talagang nagpapakapagod sa dami ng pasyente, isa lang naman ang katawan natin. However,
Yes.
uh,
Yun.
regarding that topic, Miss Roylyn, no, meron kasing lumabas na recent news in New York na nagkaroon po ng protest yung mga nurses because of the understaffing na nangyayari po sa mga hospital and facilities there. Um, what can you say about that po?
Um, Actually, ma-understand mo talaga yung like yung mga hinaing, yung feelings talaga ng mga nurses who did that. Kasi naman, ma-hamper kasi yung patient care mo. And other than that, yung parang yung kakayahan mo, yung parang gusto mong ibigay yung 100% sa patient mo, but yung nangyayari is kulang ka. Yung parang may
Mhm.
maibibigay ka pa sana, pero kulang na kulang. Kaya po yung parang napapagod ka na. And hindi ka napapagod physically, but also you get tired mentally, emotionally. Kasi parang na-harvest lahat ng nasa iyo eh. And parang wala nang natitira. So it's very understandable why they did that. Para kasi it's some sort of like an eye opener
Mhm.
to those who are in the upper ground. So they would understand, they can empathize what's really, yung mga hinaing ng mga nurses, yung workforce. So maybe that's like an eye opener for them.
Totoo naman. And do you think if you're gonna compare it in a home care setting, which has 1:1 nurse to patient ratio, is way better than the hospital and some nursing facility out there?
There are, yes and no on that.
Mhm.
Yes, yung parang you focus more on one patient. Tapos, you get, yung parang, para siyang ICU setup, pero parang step down. Kasi sa
Mhm.
ICU setup, syempre, andun lahat, di ba? Andun yung mga monitors mo, yung mga machines mo and all. Sa home care, we have that too. But, but hindi naman like super complete.
Mhm.
Yun lang yung what's needed lang ng pasyente mo, yung andun sa home care mo. Kasi yun lang yung parang practical na dapat nandun sa kanila that would help you if anything goes wrong. So yung no din the part na yon kasi um, dapat equipped ka, knowledgeable ka, para you're one step ahead
Ms. Roylene, I think
to
you're
what's
cutting out.
gonna
You're
happen next. Na hindi mo talaga mo-foresee. So that's something na, pero paano mo ka I'm sorry. How
hello,
about
Ms.
now?
Roylene.
Hello, am I
Hello.
okay?
I, you're cutting in and out na po, Ms.
Naririnig na po
Roylene.
ako. Can you hear
Ayan,
me now?
naririnig na. Yan.
Ayun, yan, nakakaloka. Okay. So, where was I?
Hello po. I believe you were talking about the comparison na po yung dun sa hospital and home care.
Okay, so going back, so may mga pros and cons din. Sa home care, yung sa hospital, you have everything there. So yung home care din, you have everything there practical to what your patient needs. So, usually happen kasi hindi naman natin alam. Maybe ngayon stable yung patient mo, but maybe later not. So, in home care, you would really establish what to do next, yung parang you proactively think what your patient would need. So that's also something na very special when you're in the home care setting.
Ayan. All right. So thank you for that, no. I think medyo mas makakatulong niya sa mga aspiring nurses natin kung ano ba talaga yung gugustuhin nila when they are planning to go here to go there in the US. And
Mhm.
going back, ma'am, you work actually before in a hospital. What kind of patient do you take care of before?
Complex yun kasi, sa ER ako nakaano, eh, sa ER ako
Mm-hmm.
nagstay. So, depende merong adult,
Mm-hmm.
pedia, depende sa pumapasok sa ER. So, different cases. Depende kung ano yung, parang complaints nila, chief complaints nila when they get there. So, ganyan.
Ayan. I understand, ma'am. So why do you think nurses needs to choose to be a pediatric nurse, ma'am? What is the
Actually,
advantage?
the advantage with working with kids, um, aside from them being lovable, they're easy to work with. Yeah. So, depende sa kid mo actually.
Mm-hmm.
So, for me, I'm with a kid na dalawa sila sa akin. They're very like wala ka talaga like problema. Like they're so cute, they're so kind, they're so lovable. Yung parang nanggigigil ka every day when you go to work. Yung parang ganun. And
Totoo.
yung parang, you really get attached to them kasi ang cute talaga nila. Tapos they're so kind. So, kind nurse, kind kid, it's vice versa yung relationship. And you get to, you get to develop like a relationship na parang, para kaming mag-ina. Yung parang, ako
Ayan.
na single ako, tapos instant anak ko na, tapos ma-attach mo, yung parang ganon.
Totoo. Parang naging second mom
And,
kayo ng mga bata.
yeah, yeah.
Talk about the being the second mom. How is the
Tas,
parent of the
it's
patient
it's
treating
it's
you?
like a rewarding feeling talaga. Every decision, you talk about if paano yung status.
Hello, Ms. Roylene. I think you're cutting in and out again.
They know more about the child parents with the parents that I'm working with. They they get me involved sa lahat ng decision nila, sa lahat ng ginagawa nila, sa lahat ng mga plans nila. Yung parang ganon.
Mm-hmm. Ms.
So
Roylene, I'm
parang
sorry.
yung
Hello?
parang nagiging one ka. Yeah, hello. Ano ba yan? Nakakaloka.
I lost you there again. Ayan. Hello, can you hear me clearly, Ms. Roylene?
Yeah.
Ayan. Ulitin ko lang po.
Yes, loud and clear.
Ayan. Naririnig na rin kita uli, ma'am. And naririnig ka na rin namin ulit. Nawala yung part na nag-asa ko, how is the family treating you since you are the person who's taking care of their children?
Yeah. They get me involved sa lahat ng decisions nila. So, whatever they do, whatever they plan, what they think is best for their child, ganun. And involved ako sa lahat. So, they get what I think. They actually opinion, yung mga gano'n, yung what do you think, what did you observe, yung parang gano'n. So they ask me what can you observe, is this something na we should be alarmed, yung gano'n, what do you think, what do we do next, yung parang gano'n.
Mm-hmm.
So involved talaga kami sa care, meron kami communication, like open communication talaga, which is very important when you work with a family, na meron kayong communication na parang hindi kayo nag-aalinlangan with each other. Like, I can talk to them, they can talk to me, yung mga ganun. That's very important
Ayan.
talaga.
Ayan. And I can really attest to that naman, Ms. Roylene. Also, sinasabi ko na rin yun sa mga orientation namin dito na ang parents is very involved when they are trying to choose you as a nurse before they can actually accept you because syempre anak naman nila yung aalagaan natin. Kaya they are very
Yes.
involved in every step of the way, decision, everything. Diba po? Ayan.
Yes,
So,
actually.
since you were with in a hospital before and you live in the Philippines before, was our transition program helpful in preparing your journey to there in the US?
Town Kids actually offered like yung housing. So that you have free housing for like a month. Tapos, to get you settled, they also give you like yung parang salary advance.
Mm-hmm.
Yeah, so they give you that para aside from syempre you'd bring your own pocket money, 'di ba, just to settle
Of
here.
course.
So aside from that, kukulangin talaga depende dun sa mga pipiliin mo, saan ka magstay, ganun-ganun yung lifestyle mo. So at some point, meron talagang may mga advance na like if you would transfer from the housing to an apartment, yung ganun advance ka nun, like 1 month advance, 1 month deposit, tapos babayad ka na naman for the next month kasi tapos na yung advance mo. Like start ka na talaga ng monthly, di ba? So, they give like an amount na
Okay. Medyo nawawala na naman po si Ms. Roylene. Hello, Ms. Roylene. Ayan, ganyan po talaga ang nangyayari pagka
salary mo.
magkabilang
So,
mundo
syempre, di
po ang
ba?
nag-uusap. Ms. Roylene, nawawala po kayo ulit.
Ano ba to? Teka.
Sige po. You were talking about the amount earlier.
Yeah, amount. My God, pag amount na talaga pinag-uusapan, no, nawawala talaga. So, going back, Town Kids would give you like an amount para masettle ka. So, you would pay that back around 3 or 6 months after. I-deduct nila sa salary mo. I'm not really sure. Hindi ko na ma-remember ano talaga yon. But they don't deduct like a month after. Like, let's
Mhm.
say 3 to 6 months, settled ka na niyan. You're earning na, you have your salary ka ng every week na, yung ganon. So, dyan sila mag-start mag-deduct sa'yo. So, parang hindi na siya masyadong mabigat.
Totoo naman po.
Yeah, so that's
Ayan.
very
So, talking about that, the Town Kids helping you with the transition. Do you love working for Town Kids, Miss Roylene?
Yeah. Yes, actually, Town Kids is a good company to work with. Though we can say na hindi naman lahat ng company perfect, 'di ba? But Town Kids
Totoo.
at it's still starting, 'di ba? So there are a lot of things to improve, a lot of things to yung parang to develop, yung parang adjustments, yung ganun-ganun. So eventually, we will all get there to have like the perfect employer for you.
Ayan. And also very hands-on naman po ang mga nasa position diyan. If you have any problems, they will address it right away if kaya
Yes.
na agad na sagutan. Ayan. And
Yes, they actually talk to you, they actually answer you. They're very responsive naman and they would answer you as honestly as possible. Yung parang binibigyan ka nila ng overview. So, hey, this is what's going on. So,
mhm.
this is your request. Can we cater it? Ganun, ganun. Mga ganun, ganun. You'd know when they
Which is
get
mas
there.
okay na which is
Yeah.
okay naman kasi
Yeah.
you'll get the proper expectation na hindi na tayo aasa sa
Mm-hmm.
ganitong bagay or whatnot.
Yeah.
And
Yes.
so, talking about that, why did you choose home care over working with nursing homes or hospitals, Miss Ray?
Okay, so when I learned that Town Kids give offers like a one-on-one, 1:1 patient ratio, 'di ba? That's something na sasabihin mo, oh, okay, so this is something na parang mafo-focus ako on one patient. So
Mm-hmm.
if you're somebody who's yung parang out of the hospital for like so long, or if you
Mm-hmm.
don't have like a hospital experience talaga, like after you graduate bakbakan ka agad outside the hospital setting. Yung ganon, di ba? So, when you're somebody na parang malayo na talaga sa bedside, tapos you'd learn na may training, you'd be equipped with exact knowledge, yung parang ganon. Tapos 1:1, alam mo nung mangyayari, everything is laid out, all the cards are there, you just have to look into it, yung ganon. So, syempre, mas yung parang may something good na parang may expect mo na, okay, hindi ako parang mawawar shock when I get there. Kasi di ba when you
Mm-hmm.
get here, you'd start working. Tapos, it's a different environment. Your adjustment is like 360 or more degrees. So, that's something na parang ang ganda ng offer. So,
Mm-hmm.
that's one of the reason why, okay, let's try Town Kids. Yung parang unbelievable siya. But it's there, it's present, it's here. So,
It's
why
really
not?
happening.
Yeah, it's really happening.
You mentioned you focus into 1:1 nurse to patient ratio. No? Do you think it is an advantage to all the nurses who aspire to go in the US?
It is an advantage actually. 1:1. Yung parang stepping stone siya. So you start with one, tapos, after some time, yung parang practical answer na lang, ha. After the contract years, if you want to renew, then go ahead and renew. But if you want to explore the rest of the world, you
Mm-hmm.
have that ability after which, diba? So if you want to have 550, go for it, diba?
Mm-hmm.
At least
Totoo naman.
you started with the basic, you started with one-on-one, you started with a good relationship, a good work ethic, good everything. Everything's stable and laid out. So why not grab that opportunity? Di ka mawawarshock in the end.
Exactly. I agree. So let's not get this take any longer. Any message to the management and fellow nurses about town?
Yeah, so for town management, thank you so much for giving us the opportunity to work here in the States, for guiding us along the way, for giving us all the things all the things, the knowledge and equipments that we would need in the area. So we really appreciate that. And to my fellow nurses, we know our goals and all the things that, we would want to achieve. So let's just go for it. Let's just continue and appreciate everything that we have right now. Everything is a blessing and everything is, you know, God's grace. So that's it.
All right. So thank you, Ms. Roylene Solon, one of our kind careners. Ms. Roylene, thank you so much for accommodating for this interview. It has been a very, very good pleasure.
Thank you so much, everyone. Thank you so much, Pastor MG, for inviting me as well.
Thank you, po. All right. So once again, everyone, let us all thank Ms. Roylene Solon. All right. So before we end this live, I want to thank everyone who's watching right now here at Facebook Live. If you want to know more, please visit this Facebook page. We will put all the updates here, and also I will put my contact number in here. If you have any questions, you can actually call me. And also, please follow our all our other social media platform. We have Instagram, YouTube, which will be tagged in here, and also our TikTok. You can also follow us there. And don't forget to always follow everything so you can have all the updates. Once again, my name is MJ Anisete. In behalf of our team here at Town Kids, goodbye and good evening in the US.
Goodbye, everyone. Thank you.
All right. Thank you, Ms. Roylene.